Hey everybody, welcome back to Ask Lex Rx. I'm Dr. Lexi, the functional medicine pharmacist here at Divine Health and Wellness inside of River City Pharmacy in Decatur, Alabama. Okay, now that we're past that mouthful, it is diabetes month. So I wanted to start off this month by going over my top recommendations for supplements for diabetes. So I'm just going to dive right in. I don't want to make this video too long for you. So my number one recommendation is berberine. It is a compound that is derived from golden seal, the plant golden seal. So it has been shown to reduce A1C and increase insulin sensitivity. So that's fantastic, especially for just one thing. Next on my list is alpha lipoic acid. It is a very potent antioxidant and helps to improve your blood sugar metabolism and increase insulin sensitivity. And bonus, over time, like over several weeks, it's been shown to help improve diabetic neuropathy as well. So win-win there. My next one is chromium, and this is a mineral that actually helps improve insulin sensitivity and decrease fasting glucose levels. Now, I want to take us an aside here for a second. Insulin resistance is when your cells are no longer able to listen to the insulin signals and take the sugar from your blood into the cells so it can be used for energy. And then it's just floating around in your cells and then eventually gets turned into fat, which is not good over time, right? But that is when your blood sugar starts to increase. So when we're talking, or when I mentioned something about insulin sensitivity, this is reversing the insulin resistance. So this is really, really good. This is insulin sensitivity is what we want. Okay. Next, so that's chromium. Next is cinnamon. Yeah, the spice, right? So that cinnamon actually helps increase insulin sensitivity as well. Then we have biotin, which is a B vitamin, and that actually stimulates sugar-induced insulin secretion. So when you have normal levels of biotin, when you eat things that break down into sugar, then it helps that insulin secretion when you do eat those things. It also enhances insulin sensitivity, enhances blood glucose metabolism in the liver and the pancreas, just like the alpha lipoic acid does. And so it's always also a good one to have on board. All right, I have two more for you. One is coenzyme Q10. You may have heard of this, but it is heavily involved in energy production. It's a potent antioxidant, and a lot of people with diabetes or prediabetes are put on medications called statins. And these medications can deplete your CoQ10, and they do this for protective reasons, but this can help improve statin-induced depletion of CoQ10. So then, last but not least, are the omega-3 fatty acids. If you know me, like my top two recommendations are always like probiotics and omega-3 fats, but they're so important. They're anti-inflammatory. They can reduce your triglyceride levels that increase with increased blood sugar and excess carbohydrates in the diet. So this is also a really good one just to have on board all the time. So to kind of summarize real quick, my top supplement recommendations, and by the way, I don't recommend all of these in every patient, but my favorites are berberine, alpha lipoic acid, chromium, cinnamon, biotin, coenzyme Q10, and omega-3 fatty acids. If you have any questions, let me know, and I'll see you guys next week.